Ever wondered what diseases can be caused by a snake bite? The reality may surprise you. The world of snakes is a fascinating yet formidable one. These creatures, many of which are beautifully adorned with intricate patterns, are found in nearly every corner of the globe. Unfortunately, their presence is not always benign. Each year, an estimated 1.5 million people worldwide experience a snake bite, and of those, a significant number suffer severe health consequences. These figures underscore the importance of understanding the health implications of snake bites. Let's delve into the world of snakes a bit. Broadly speaking, there are venomous and non-venomous snakes. Venomous snakes, as the name suggests, inject venom into their prey or potential threats. This venom is a complex cocktail of proteins and enzymes designed to immobilize, digest, or kill. When introduced into the human body, it can trigger a range of health effects. Non-venomous snakes, on the other hand, lack venom. A bite from these snakes, while it may be painful, typically does not cause the serious health effects associated with venomous snake bites. However, even a non-venomous snake bite can lead to secondary infections if not properly cleaned and treated. Now, what happens when a venomous snake bite occurs? The health effects can be immediate or delayed, local or systemic. They can range from mild symptoms such as pain, swelling, and bruising at the bite site to severe symptoms like paralysis, kidney failure, bleeding disorders, and in extreme cases, death. Moreover, the psychological trauma following a snake bite is often overlooked. The fear and anxiety associated with the incident can lead to long-term mental health issues in some individuals. So you see, snake bites are not as rare as you might think, and their impacts on health can be severe. As we journey further into the world of snakes and snake bites, we will uncover the diseases caused by these encounters and explore ways to prevent them. So stay tuned and remember, knowledge is the best defense. Snake bites are not as rare as you might think, and their impacts on health can be severe. Venomous snake bites are no joke. They can lead to serious diseases. When a venomous snake bites, it injects its venom into the victim's body, causing a variety of health problems. The venom's composition, which is a complex cocktail of proteins, enzymes, and other substances, determines the type of diseases that may occur. One of the most common diseases caused by snake bites is necrosis. Necrosis is the death of body tissue, which can occur if the venom contains cytotoxins. These toxins attack the body's cells and tissues, causing them to break down and die. Necrosis is particularly dangerous because it can lead to amputation or even death if it's not treated promptly. The affected area may exhibit symptoms like swelling, blistering, and blackened skin, which is a sign of dead tissue. Another disease that can result from a venomous snake bite is hemorrhage. Some snake venoms contain hemotoxins that affect the body's blood clotting mechanism. When these toxins enter the bloodstream, they prevent blood from clotting, leading to internal or external bleeding. This bleeding can cause serious complications such as organ damage or even death if it's not controlled quickly. Symptoms of hemorrhage include unexplained bruising, blood in urine or stool, and in severe cases, shock. Paralysis is another severe disease caused by snake bites. Certain snake venoms contain neurotoxins that affect the nervous system. These toxins can block nerve signals, leading to muscle weakness or paralysis. Depending on the venom and the amount injected, paralysis can affect a small area or the entire body. In severe cases, the venom can paralyze the muscles used for breathing, leading to respiratory failure and death. Symptoms of paralysis include difficulty moving or controlling certain parts of the body, difficulty swallowing or speaking, and in severe cases, difficulty breathing. It's important to note that not all snake bites will result in these diseases. The type and severity of the diseases depend on several factors, including the species of snake, the amount of venom injected, and the victim's health condition. However, it's also crucial to remember that any venomous snake bite is a medical emergency that requires immediate attention. In addition to these diseases, snake bites can also cause other health problems, such as allergic reactions, infection, and psychological trauma. Allergic reactions can occur if the victim has a sensitivity to the venom, leading to symptoms like hives, difficulty breathing, and shock. Infections can develop if the bite wound isn't cleaned and treated properly. Psychological trauma is also common in snakebite victims, as the experience can be extremely distressing and life-changing. As we can see, the diseases caused by snakebites are diverse and potentially life-threatening. Non-venomous snakebites aren't harmless either. They can lead to infections and other health complications. Let's dive into this a little deeper. Non-venomous snakes, despite not delivering a toxic cocktail through their bites, can still pose a threat to our health. When a snake bites, it introduces bacteria from its mouth into the wound. This can lead to a range of infections, from minor skin infections to more serious ones like cellulitis, an infection of the deeper layers of the skin and the tissues beneath. If left untreated, these infections can potentially spread throughout the body, leading to sepsis, a life-threatening condition. Sepsis occurs when the body's response to infection spirals out of control, causing inflammation throughout the body. This can lead to organ failure and, in severe cases, death. In addition to the risk of infection, non-venomous snake bites can also cause physical injuries. Depending on the size and species of the snake, a bite can result in puncture wounds, lacerations, and in some cases, deep tissue damage. And let's not forget about the psychological impact of a snake bite. The event can be traumatic, leading to emotional distress and anxiety. This is particularly true for those with a phobia of snakes, known as ophidiophobia. This is why it's crucial to seek immediate medical attention after any snake bite, venomous or not. A healthcare professional can properly clean and dress the wound to prevent infection, administer antibiotics if necessary, and provide care for any physical injuries. They can also offer support and resources for coping with the psychological effects of the event. It's worth noting that while non-venomous snake bites are generally less dangerous than venomous ones, they should still be taken seriously. Every snake bite is a potential medical emergency. So, the next time you stumble upon a snake, remember this. It doesn't have to be venomous to be dangerous. Treat every snake bite with the urgency it deserves, get to a healthcare professional as soon as possible, and give your body the best chance to recover. Even a non-venomous snake bite can be dangerous if not properly treated. Prevention is always better than cure. This holds true even for snakebite diseases. When it comes to preventing snakebite diseases, the first step is to avoid encounters with snakes altogether. How do we do that? By steering clear of their habitats. This might seem obvious, but it's easy to forget when you're out enjoying nature. Snakes can be found in a variety of environments, from forests and grasslands to deserts and bodies of water. So if you're planning an outdoor adventure, do a little homework first. Learn about the types of snakes in the area and their preferred habitats. Next, consider your attire. You might not think fashion plays a role in snakebite prevention, but it does. Wearing protective clothing can be a literal lifesaver. Long pants and boots, preferably ones that are snakebite-proof, can provide a barrier between you and a snake's fangs. Also, remember to use a flashlight and wear gloves if you're rummaging around in dark or cluttered places where snakes might be hiding. Now, let's move on to being vigilant in snake-prone areas. This means keeping an eye out for snakes when you're walking or hiking. Stay on well-trodden paths, avoid tall grass, and never put your hands or feet in places where you can't see. Snakes are masters of camouflage and can easily go unnoticed until it's too late. But what if, despite your best efforts, you do get bitten? This is where the importance of immediate medical attention comes into play. Even if you think the snake wasn't venomous, it's crucial to seek medical help right away. Remember, the effects of snake venom can be delayed, and every second counts when it comes to preventing snakebite diseases. In conclusion, prevention of snakebite diseases comes down to a combination of avoidance, appropriate attire, vigilance, and swift medical response. It's about being aware, being prepared, and taking action when necessary. Remember, a little caution can save you from a lifetime of potential health complications. Knowledge is power, especially when it comes to preventing snakebite diseases. Education and preparedness are our greatest tools in mitigating the risks associated with snake bites. Understanding the diseases caused by these bites allows us to anticipate, prevent, and treat them effectively. Knowledge of snake habitats, behaviors, and the symptoms of their bites can save lives. It helps us to avoid risky areas, take the right precautions, and seek immediate medical help when necessary. Just as we prepare for natural disasters or accidents, we should also prepare for the unlikely event of a snake bite. This includes familiarizing ourselves with first aid procedures, knowing the nearest medical facilities, and being aware of the types of snakes in our vicinity. Education is our shield, and preparedness our sword in the battle against snakebite diseases. The power lies with us. Stay educated, stay prepared, and stay safe from snakebite diseases.